Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on health. Believe it or not, Milwaukee has one of the highest sexually transmitted disease rates in America. And earlier this month, city leaders actually held a press conference to address rising numbers when it comes to HIV and other STDs. The preliminary number of new diagnoses of STDs in 2017 included 117 cases of HIV, 53 cases of syphilis, and over 4,000 cases of gonorrhea and nearly 10,000 cases of chlamydia. My first guest is Dr. Patricia McManus, who serves as the health commissioner for the City of Milwaukee. How are you?
I'm good. How are you?
Always a pleasure to see
Thank
you.
you.
Busy lady these days.
Yes, I just keep running out of the way, you know, trying to go fast.
Yeah.
You can't hit a moving target.
Well, I want us to jump right in. First, let me congratulate you on being named health commissioner for the city.
You.
It's a big task, but these are the type of subjects that we have at hand. As I said, Milwaukee is one of the worst cities in the nation in regards to sexually transmitted diseases. So if you would bring us up to date with these numbers that we've seen a spike in.
Well, yeah, I mean, the main thing we're looking at certainly is that an STI is related to, like you said, it's HIV, it's syphilis, it's gonorrhea, it's chlamydia. It is odd to see so many all kind of come at the same time.
Yeah.
And that question becomes whether there's intermingling in terms of who sees who, how they get them. For about 3 or 4 years now, though, we've been the highest for black males who are men have sex with men. We've been the highest in that at least about 4 or 5 years now, and still up there. And so we have all that, and people always want to know, how did that happen? You know, what is everybody? Are they more promiscuous? Are they all that? You have to look at all the what's called social determinants, but I always try to correct people that these are really health determinants in terms of we're about the only country in the world that doesn't consider where people live and what their circumstances are can relate to their health. And so in Milwaukee, that's a major problem. We're also one of the hubs for human trafficking, which is just becoming part of that.
Yeah.
And certainly when you fold that into what's happening, it's not unusual that you find more people having sexually transmitted diseases.
Yeah, it makes a lot of sense. And so would the opioid epidemic have anything to do with that as well?
Well, another part of it, I mean, once you're hooked, you do whatever you need to do to get the drug.
Yeah.
So then you clearly have more participation in that as well. So we kind of trifecta there if you look at all of it.
It's helpful to really kind of break it down, because when people do hear these numbers or see the headlines, it's kind of frightening. As you know, it's very understandable.
And another thing too I want to say is that for a state like Wisconsin that's predominantly white, predominantly rural, if somebody's having a problem, we also know that people travel down to Milwaukee to get their testing and may give an address that's not valid. So that's another part of that too, is that we have that as well. I don't know if you've ever been told that before, but that's another piece.
All right. Well, we keep hearing this term cluster, and when I read it, I didn't quite really be able to put my finger on what that meant. So you have some 76 people who have tested positive for HIV and syphilis or one of the others. So what does this cluster mean per se?
Well, the cluster, when you think about the cluster from an epidemiological term, it is that you got a group of incidents of these diseases clustered together. You know, they're together, that you kind of see. They probably have both. They probably have some social networking trend of it, but they also are spreading the disease among each other. That's what that means.
Okay.
Again, for us, so when you look at those numbers, even when the 118 or 125 or 127, when they look at the total thing, that's social networking, in which you look and you figure out who they're, because you want to get partners notified. So you have information about the primary client, but then you have some information about who they may have had sex with. That's that social network.
So it's a connection.
So it's a connection, but it may not be that they all have. Most of them don't. Either they don't have any disease or they don't know. The status is unknown. So that's the broader difference. So instead of saying, like my daughter told me last week, that on social media people were saying there were 125 kids that had. I mean, you see how it moves.
Yeah. Oh yeah.
And I'm telling her, like, no.
That's why we have you here today. Really, there needs to be clarification, because sometimes people don't pay attention to detail, and they kind of spread what they think they heard.
right.
And it is true, though, that there was a small number of young people under the age of 18, and there were also a few babies who have been born with syphilis.
There were definitely 3, and that's something, to me, that's one of the most sentinel events out of this. I can't remember in a while having babies born with syphilis because of what's going on. So that does tell you that this is something we got to pay attention to. You know, it's more even that in terms of this is something we need to do action on, that we need to try to figure out, because something's happening within our framework to have those type of diseases occurring. And again, babies, maybe we don't do as well as we should do, but for babies to get syphilis, you know, this is like somebody talking about polio. I mean,
yeah,
you just don't
that's what one of my friends in New York, she said,
you just don't expect that.
I haven't heard syphilis talked about probably
for babies. Since, that's right.
Man, I don't know when. So that's a great point that you bring out as well. So when we talk about this being a headline, what in fact would you like to see done to help spread awareness or make sure we get a grasp on what's taking place?
Well, the first thing is that we got to work as a collaborative. People can't pick their individual ways to do it. We've got a lot of good places in Milwaukee, you know, whether it's public, whether it's private, that want to address this. So we all need to get together and try to work together, which also means then that everybody's not going to get everything they may want, but we got to figure out if the target is the population and those families that we want to work with, we have to figure out how to do that. The schools, certainly, and certainly the schools, I think, I remember in '87, I opened up the first school-based clinic in Wisconsin, and I was in North Division. And you have to be mindful of how parents think about their kids, no matter what you think about them. You know, you've got to be, parents can be great allies if they understand that you care about their role. So that's got to be part of that environment. And we've got to have places where people can come and they feel comfortable. You know, we have to deal with the age of teenagers who can go places like Planned Parenthood or other places and get tested without having parental consent. That doesn't mean that you're going behind their back, but you're trying to get them tested so then kind of work with the parents. So we have to have a way of making sure that we are talking to youth about understanding what that means, what their behaviors. They're still in that vulnerable stage of, well, that happens to other people, not me.
Yeah, that there are consequences, and for some of these, such as HIV, herpes, there is no going back.
Right.
You can't fix it or change it. All you can do is look and say what you wish you had done differently.
And a disease like syphilis, I mean, they have symptoms at first stage. Second stage, don't have anything. Third stage, it's in the brain. I mean, so you're really looking at that. That's folks need to be mindful of.
Yeah.
Right,
it always makes me think of the Tuskegee experiment, and it's
think about that.
Just so much. So what I definitely want to do before we wrap up is make sure we remind the viewers of the different health clinics that operate underneath the umbrella of the Milwaukee Health Department. So you have the Northwest Health Clinic, and then
South Mill Road, and then the South Side.
And then the Keenan Health Center. And the Keenan Health Center offers this testing that is confidential and anonymous, that is very important, like you said, especially when it comes to early detection. Right,
and they can come in, they can walk in, they can call, but they can walk in anytime. We want them to come in. We kind of ramped up services so people will be there all the time if they need that. Got good staff out there who are very sensitive to the issue, so yes, we want them to feel comfortable coming.
Well, I thank you so much for coming by here today and helping us better understand what's taken place. And you're welcome to come back anytime you want to get a message out on what it is you're dealing with there at the Milwaukee Health Department.
Thanks a lot.
It's been a pleasure. Dr. Patricia McManus is the Health Commissioner for the City of Milwaukee. And when we return to Our Issues Milwaukee, we'll continue our focus on health and find out more about the programs and services offered at Wisconsin's largest provider of HIV treatment, the AIDS Resource Center of Wisconsin. We'll meet their president and CEO, Michael Gifford, right after this.